Structures of bones. So when we look at bones, you will need to be able to talk about the articulations. So this is where bones contact other bones. Then there are particular landmarks about bone markings which are particular for bones. So the tibia has got a linear aspera that runs down it, called that's quite prominent, and we use it when we're doing health assessment. And the foramina, which is opening for the nerves and blood vessels. So of course, whilst the bones are very strong, they are of course living. So bones are living, and they have their own nerve and blood supplies. So with bone markings, you can have depressions or grooves along bones, elevations or projections where tendons and ligaments attach and articulate with other bones, and you can have tunnels where blood and nerves enter through the bone. So here we have an introduction to bone markings. So on the far left, we're looking at a long bone called the femur. That's the big thigh bone that goes from the knee right up into the hip joint. So the top of the bone, we can see the round head, and the two large projections off the side is the greater trochanter, and then on the other side is the lesser trochanter. The head of the femur is joined to the shaft of the femur by what is called the neck of the femur. Down the other end, you've got a tubercle and a facet, which is a part of the smooth surface which makes up the condyle, and the condyle articulates with the tibia, which is where the knee joint is. You can see in the bones of the skull that there are many small bones. You can see that the pinky areas are the sinuses, so they're the air-filled pockets of the bone to make our head light enough for us to be able to walk upright. And different foramen and fissures, and a long stretch of bone called the ramus is part of the mandible. You can see on the humerus that we have other bony landmarks called the tubercle, the head, the sulcus, the neck, the tuberosity, the fossa, and the trochlea. Then if we move over to the final part of the pelvis, you've got what is called the crest of the pelvis, and you should be able to palpate the crest of your pelvis, the spine and the fossa, the line or the round line on the inside of the pelvic bone, the foramen, and the ramus. We're going to go now through the structure of the long bone. So on the next slide, we've got this picture. So you locate that picture in your book and you can follow it through. So the diaphysis is called the shaft, and it is a heavy wall of what is called compact bone or very dense bone. There's a central space within the diaphysis which is called the medullary cavity, and whilst it is space, it is not hollow, it's filled with bone marrow. At either end of the diaphysis we have what is called the epiphysis, which is the widening part of the long bone, and this articulates with other bones. It's mostly made of spongy bone, which is why it is prone to injury, because it can compress down, and then it is covered with compact bone. The line between the diaphysis and the epiphysis is called the metaphysis. The metaphysis in growing children up until the age of 18 is where the bones get longer from. So the metaphysis is the area of rapidly dividing bone cells where the bones get longer. So now we can look at this diagram, and again you can see that the top of it we've got the spongy bone, and the medullary cavity either side of it has got compact bone. The ends of the bones are called the epiphyses, and the shaft of the bone is called the diaphysis. And the two areas where the diaphysis and the epiphysis join is the metaphysis, and this is where the bone grows in length.